morning, everybody. This is Dr. Shehab Eletriby, Associate Professor of Cardiology in Ain Shams University.
Good morning, everyone. I'm Dr. Wael Abou Shokka. I'm a consultant intervention cardiology in Al Qasimi Hospital, Emirates, United Arab Emirates. So today we are having a very interesting topic. It is about calcification in Cathlab, coronary calcification. Dr. Shehab, I know you are one of the rising stars in interventional cardiology in Egypt right now, and I left Egypt a long time ago, so I want to know what is happening in management of calcification and what tools you have in the time being.
Well, in our center and in Egypt mainly, we have a lot of things to deal with calcium. We have cutting balloons, we have scoring balloons, and we have also the Navi score, which is the combination between the cutting and the scoring balloon. We have rotablation, and we have IVL.
So, you know that we are a center of excellence in this area. There is another modalities like orbital hysterectomy and laser. So, do you think that these items should be around, or you are doing with the available items? It's successful in 90% of the cases.
Well, it's actually doing 90% of the cases, as you said, but it's more important to have also orbital atherectomy with rotation atherectomy. It's more user friendly. It's easier to deal with, especially the osteal lesions and long calcific lesions.
Yes.
It is safer for the patient. It's never stuck like the rotabird, I think.
And with tortuosity, as you know, because wire bias that happen with rota, it doesn't happen with orbital because of the movement. As you said, in aorto-osteal lesions and in large calibers, vessels more than 4, it is very favorable. And as you know, because of standing effect, the incidence of no reflow is less. So what do also laser? Laser is, as you know, I'm sure you know that it's not used mainly for calcific lesions, but we use it sometimes in CTOs with severe calcification, uncrossable lesions. And at that time, if you want to use it for calcific lesions, you do what is known as bombarding, which is injecting a very little amount of contrast. Usually, you shouldn't inject any contrast. It's either saline during your lasing or no saline blood, and this increases the energy, but not too much. But if you need a lot of energy, if you have a calcific, very calcific lesion, we do bombarding.
What about the acutely unexpanded stent? Do you prefer IVL or laser, or what's your?
We do IVL. It's off-label. I'm a laser fan, so I do lasing for these cases, and it is very successful. But out of this, very stressful, after this kind of cases, when you stay for 1 or 2 hours under this kind of stress, lasing, doing atherectomies, how can you break this stress? What activities do you do after?
Well, I think exercise is the most important thing. You don't, not especially the gym, just walking, running, relieving the stresses of the day, sitting with the family, having fun.
Yes.
And but what about you?
For me, it's I'm a fan of extreme sports. I do horseback riding, a lot of horseback riding, and it's the most stress relieving for me. I do trice run, jogging, cycling, swimming, gym, and this is also something I think we need to stress on our patients. that it's not only interventions, operations, medicine. Lifestyle modification is something very important to do at least 30 minutes per day, even for a healthy person. This will give you more longevity.
I advise my patients to just park a bit away from work and walk this distance just to break the ice. I know, walk and then run. He'll develop the skills.
Yes, it's only about it's a state of mind. If you are asking your patient every time he comes, every time he comes to my clinic, okay, are you following your diet regime? Are you following your exercise regime? So most of them, oh yes, I walk every day. Okay, how long you walk in? Because we know that it's all about the heart rate, and if you did not, the heart rate did not pick up. Usually it's 55 to 65 of target heart rate for an exercise ECG. If he's like a 40 years old and he's walking and his heart rate is 90, he's not getting anything.
Yeah, of course.
So this is a very important.
Not only medication.
So I think we have to stress more and more, because this is prevention. And if we need to, if we want to achieve what was the goal to reduce the cardiovascular mortality 25% by 2025, it's not about doing a primary PCI. It's how to prevent the patient to come to your Cathlab table.
Yeah.
It was very nice having this conversation with you, and I hope our audience and our colleagues will benefit from this. And in the end, I want to express my deepest appreciation to the GIS committee for this, for organizing and achieving this great successful successful meeting. Having a lot of very successful live cases, a lot of very interesting
complication
yes.
cases. And,
so what do you think about this year GIS?
I think it's very important, the training village. I learned a lot from it.
Yes, the training.
Especially orbital atherectomy.
Yeah, you need to come. I'm doing another one. We are doing a lot of workshops on this. Okay. Have a great day, everyone. Thank you, Dr. Shehab.